A quick puzzle, quick quiz for the old comers. What's missing from the stage that we used to have in previous editions? The answer is somewhere there on the top. The 112 box, that's missing also with the other boxes. Remember to pick up the boxes from your metals. Now, in our first session, I will ask our chair for the first session, Ruth, to join me, and also Costa, Christof. So we can discuss the pandemic's impact on our work, and we will go over lessons learned from this unprecedented crisis. Stay with us, please. There are no breakout rooms for now, so please stay with us.
Wow, today is a special day, the EENA crowd. It is just lovely to see you guys after such a long wait for the together time. And let's use this special moment to speak about how to face the COVID pandemic together. I don't need to introduce you to Dimitri, the Master of Ceremony and the Director of the Medical Services of the National Center of Emergency Care of Greece. But I would like to introduce you to our colleague Christof, who we lovingly called Costa in the EENA family, the CEO of Emergency Communications and Coordination Center of Lower Austria. And we will be joined from abroad by François Braun, the president of the French Emergency Medical Services Association, who was summoned to the French Parliament last minute and will join us over the video. My name is Ruth Erdelyiova. I serve with the Resilience Advisors Network, learning how to support user-driven and service-focused progress of emergency and crisis management services, working side by side with EENA. Supporting the development of emergency services and resilience of communities across the globe, I really thought I've seen it all until the COVID pandemic came and changed the way I live my life and do my work. Anyone in the room feels the same? Yes. I see some nods, some gently raised hands. Well, with the pandemic descending upon us, we have witnessed systems of governance and service deliver temporary overload while struggling to adapt. We faced the scary silence and the standstill during the pandemic lockdowns of our private worlds, with more questions than answers, amidst frantic efforts to understand what is happening and how to keep loved ones safe and save as many of those we serve as possible. Some of us even face direct confrontation with the disease, loved ones exposed, and others the pain of losing those we care about. But we have also witnessed unprecedented bravery of first responders and medical staff on the front lines. Heroic efforts by emergency call takers now having to face the fears of the public by providing additional information on the pressure to maintain efficient, effective service. We have seen touching outreach and selfless support in communities by volunteers and neighbors, but also analytical systems quickly adjusted to new data collection strategies and algorithms to help predict developments and support informed choices by emergency response and beyond by dedicated tech pros all over the world. We've watched researchers racing to use their knowledge and institutions build testing, tracing, and vaccination delivery mechanisms to save millions. The COVID-19 pandemic posed many challenges for emergency services and required a great deal of adaptation in a short time frame. Emergency call centers heavily impacted in many countries, whether in terms of change of volume of category of calls, the introduction of new protocols, the establishment of new measures to protect staff members and resilience of their service delivery mechanisms. Complex measures had to be taken by governments and emergency organizations to address these, and I would like to now invite you to explore them further together. In almost every country, we saw a surge of calls related to COVID-19 in February and March 2020 at the start of the pandemic in Europe. We will try to understand how emergency services organize themselves to deal with the surge of calls and share some of the acquired wisdom of lived experience. First, we'll hear from Dr. Braun, as France was one of the first European countries along Italy and Spain to be impacted by COVID-19. Before a long number was created and dedicated to provide COVID-19 information, emergency number 15 was displayed as the official number to call for COVID-19 related inquiries. Now we will hear how the SAMU organized to manage the surge of calls.
Dear colleagues, I'm confused not to be among you and apologize for it. All was ready, my airplane ticket, my hotel, but the current difficult discussions between the SAMU and the fire department forced me to stay in France to be, this morning, with our congressman. As you know, in France, nothing is simple. If you don't mind, I recorded my answer to a few questions. What did we do to organize the SAMU to manage a surge of calls? As you know, in France, we have a specific number for medical emergencies, the 15. At any time, you have a doctor on phone, an emergency physician, and a general practitioner. Annually, we receive 31 million calls for more than 18 million medical affairs. The first wave was more a real tsunami for us because the increase in calls achieved in 1 or 2 days for each center. Even if we have been alerted by the third cluster identified at the border of the Paris area. The request from the local emergency center increased by 250% overnight. Around the country, the increase at the same time was 30%. The next day, it was the second level on 3 of our national emergency plan. In the emergency call centers, the highest level of the wave was between March the 10th and the 25th, 1 week before for the northeast of France than in Paris. Comparing the number of calls to our different call centers, police, fire brigade and medical call center, only the emergency medical call centers were concerned by the surge of calls. For our 100 EMS, it was 80,000 more calls per day, corresponding to a global increase of 200%. To face this situation, we had 2 solutions. First, increase response capabilities, and second, modify our organization to make it more efficient. The capability response was based on the reinforcement by healthcare professionals with a fast 1-day and validated job adaptation training and the implementation of the necessary tools, phones, switchboards, workplaces. Majority of these new professionals were medical and nurse students and retired doctors. Because all the usual activity was at rest, it wasn't difficult to mobilize these troops. The efficiency of the organization has been improved by the establishment of a 2-level filtering response and the organization inside our medical call centers after this first level of different sectors. One for the vital emergencies, one for the people with symptoms of COVID-19, another one for people with usual symptoms, and one for people asking for informations. Another solution was an automatic sending of short message for people who have hung up the phone, giving the national number for informations. The possibility of teleworking from home, in addition to our workstation, was another solution, and the capability of reinforcement of a call center by another in the same county was another solution. Technological innovation like video call, the exchange of information in real time between all the medical call centers, for example, were other solutions. Always, our main concern was also not to overload the emergency departments. And with our medical regulation in our medical call centers, and with the help of general practitioners and nurses on the field, coordinated by the medical call center, I think it was a success.
Thank you very much, François. And now, Costa, maybe you should tell us what you had in place before the pandemic in terms of medical emergency and medical non-emergency numbers. Was the existing structure of NNO useful to face the pandemic? What did you have to change to deal with the surge of calls?
Yeah, in Austria we had really the luck that in 2017, so 3 years before the pandemic started, we established a new nationwide non-emergency telephone number. It's a nurse triage hotline. The goal of this hotline is, it's 1450, is that we direct the patient to the best point of service. So we want to take the low-level calls from the emergency numbers to this new number. It was established in 2017. On the phone we have nurses, special skilled nurses, and they're using a strict protocol. And when the pandemic started, this 1450 was the new Corona hotline. I hate this spelling of 1450, but it was established as that. So if you had any flu symptoms, if you think you are Corona positive, call 1450. And that made it happen that we had no overload on the other emergency numbers. So we had no waiting lines for normal emergencies. 1450 is done in the same comm centers as the medical emergencies are done, but by different people. And what we did is we established very fast a special Corona protocol, which could be done by simple call takers. They don't need any medical skills. The goal was to check with a few questions, has this person to be tested or not? Has this person to be separated or not, in quarantine? Does this person need additional medical treatment? And because of that, we were able to do an unbelievable workload of calls. So normally on 1450, on a normal day basis before pandemic, we had roundabout, I'm responsible for the biggest state of Austria, Lower Austria. We had roundabout 500 calls, and this was a busy day. In the first week, these calls were going up to 18,000 per day. So it was an unbelievable workload. In our centers, we had home office for years. We have a possibility to engage all the back office people. So in the first days, it was really hard. Then we engaged additional personnel very fast. These were nurses on training, young doctors at the university, and so on. So medical skilled persons. We trained them in 3 days to follow these strict protocols, use every word of this protocol to be sure that they do it right. And with these people, these additional people, we were able to get this workload. So our main goal was to separate positives very fast, to test them on the same day, first with mobile testers, then we had drive-ins, as everybody had. So it was possible from the telephone call to have a positive or non-positive to separation. It was less than 24 hours. And with this, the first and also the second wave of the pandemic in the comm center was, we did it. I can say we did it. But once again, without 1450 established 3 years before, it would be it would be impossible. We had to establish a new number within days, and it would be 3 times harder than it was.
Thank you very much for sharing this important experience, Costa. You've illustrated some key principles of COVID-19 response, including the need to be flexible in introducing new solutions and adapt operational procedures based on protocols which actually reflected on the dynamics of the challenge that needed to embrace at the level of emergency call taking. Dimitri, at the start of the pandemic, Greece was just starting to overcome the effects of financial crisis. So here we are, beyond emergency calls. Please tell us, how did you organize hospitals early 2020 to be ready for the wave to come? And what were the challenges in providing emergency care in the more remote communities on the islands? Because that's an additional challenge in Greece to be addressed.
Yeah. Well, as you said, we were coming out of an small financial crisis, combined with a small migrant crisis, combined with forest fires. But yes, it wasn't the ideal conditions. What happened with the ambulance service, and I need to remind everybody that we have one nationwide ambulance service. We immediately established the crisis response team, which became operational on a 24-hour basis, and to coordinate not only the call taking. The call taking, we didn't have a problem because it was the COVID calls were taken by the equivalent of the Greek CDC, if I may say so, which had a well-established number. And this was even more published, so the calls were there. So the calls that we were receiving in the ambulance service, it was that I talked with the ECDC and they told me to call an ambulance. So that was pretty much taken care of. And we were diverting calls towards there, so we didn't have that problem. The problem was with the hospitals, because we have a unique rotation system of hospitals being on duty and all that. And we needed to establish COVID clinics like everybody did, but we needed to establish in all hospitals and then rotate them to make sure that they don't fill up to the brim. And soon enough, we asked all directors of the hospitals to make a 3-tier plan. So 60% capacity, 80% capacity, and 100% capacity of the hospital beds that they had identified as COVID beds. So at 60%, they had to increase a little bit their capacity. When they were up to 100%, we knew we had to revert to another hospital and another hospital. Initially, we didn't have dedicated COVID hospitals. At the end, we had to have 2 in Athens, 2 dedicated COVID hospitals, although other hospitals were also receiving patients. In Greece, we also had a fine division line between the national health system and the public sector. During the pandemic, the government, the national health system, practically rented beds for the private sector for non-COVID patients. So the private sector did not treat any COVID patients. All COVID patients were treated at the public hospitals, but the private sector took a lot of load for regular cases to treat and left more hospital beds to be available in the public sector for COVID cases. We also identified that our ambulance routine became completely different during the lockdown, because for once, ambulance personnel didn't have to run like crazy on Friday and Saturday nights to take care of car crashes, drunk people, and stuff like that. It was quiet nights, Friday and Saturday, completely different from what we used to be. That's an overall, if you like, review of what's happening.
Thank you very much for so colorfully sharing the experience. You again illustrated yet another key principle, and that is cooperation across different segments of service delivery is key to our ability to actually adapt capacity and deliver service to those who need it in the best way possible under the given circumstance. Now, Costa, NNO is a pioneer when it comes to remote call taking. How useful was this according to your experience during the pandemic? And are we going to deliver our services differently in the post-pandemic world, do you think?
Yes, and yes. We established home office for call takers, I think 2015 or 16, and I was speaking on other EENA conferences and navigator conferences around the world, and everybody was shaking his head, and how could you do that to allow call taking on emergency numbers from at home? What's about data protection and all these things? And we established it as a benefit for the best call takers. So that was the idea. If you have a protocol compliance for 100%, more than 3 consecutive months, you get extra payment and you are allowed to do call taking from at home. So that was my idea as a motivation, and it was well taken by our call takers. And the second thing was that not only within Austria, also in parts of Germany, Nord Niederösterreich is known as a cool company, and a lot of people wanted to work for us, but they don't wanted to travel 400-500 kilometers for a shift, and we allowed call taking also for these people in different countries. So Germany is another country. So you are working based on Austrian law in a home office in a different country. And when the pandemic started, we expanded it very fast. So at the moment we have, I think, 230 call takers, and around about 180 of them are home office fit. So they are allowed to take home office. Some don't want to do home office. If you have small children, mostly fathers, when they have small children, they want to come to the company. But they really enjoy it, and we have a rule like you have to do 4 shifts per month in the center, the rest can be done at home. And during the pandemic, it was mandatory to do home office. So nobody who could do home office was allowed to come. And that had 2 positive effects. We had enough personnel. We don't have any quarantine positive problems within the center. That was very good. And at the peaks, we needed 100 to 120 call takers in a shift. Normal, we have 40 to 50 on a peak day. So we needed 120. We had days with 140 call takers. We wouldn't have enough workplaces for these people. So they could sit on the stairs or I don't know where. So it's more efficient. The people like it. And yes, we are keeping it right now. So we are coming now to a more home office normal phase, but we are now discussing, is it sinful that you have to do 4 shifts per month in the center? So it's only a rule, it makes no sense. What people like is the social thing. They are missing social interaction with the others. And yes, some of them, because of the pandemic, they have no problems in their relationships, and all these problems we all know coming out from the pandemic, they want to come. But once again, if we wouldn't have home office before, we would have a problem. And the main advantage was that our system, since the beginning of our company, was a cloud-based system. So we have one center on more than one location, and if you are working from at home, it's like one more center, one more branch, nothing special. So if you use modern technology, home office is no problem.
Perfect. What I hear in your important message is a reflection on that we need to put the human back into the service for humanity, utilize the potential of technology to enable us to adapt capacity quickly and from anywhere at any moment and any place. And that is truly impressive and an important development in the way we adjust capacity to be efficient and effective. Now, there was a number of really creative solutions deployed to actually address the challenges of the COVID pandemic. And I think we've all seen incredible pictures of the transport of patients by high-speed trains across France to release pressure on some of its IQs. We will hear from Dr. Braun now, how they had this idea and what it brought to France.
Now, what about the transport of patients across the country? After the terrorist attack, we had the idea, in case of a large terrorist attack in a large part of our country, to test the possibility of transporting serious patients by train, like our elders did during the First World War in Verdun. This idea became an disaster medicine drill in March 2019 between Paris and Metz, my city in the northwest of France. 1 year after, it was obvious that we had to do the same thing to transport COVID-19 ICU patients from very overloaded region to quieter region. It was the only solution to make places in ICU for patients waiting for intensive care. We used two complementary solutions that we called drainage and incision. The drainage was daily, simple, unitary transport, and the incision was the transport of many patients at the same time, by military airplane and by high-speed trains. During the first wave, more than 600 ICU COVID-19 patients were transported by our emergency medical teams, including 200 patients by train. After this first wave, the strategy was most clear for us. To face this pandemic, we have now different tools. The vaccination, of course, but it is not immediately effective. The lockdown, to reduce the circulation of the virus and to decrease the other pathologies, especially traumatic ones, but it's socially difficult. The reinforcement of the capabilities with more materials and healthcare professionals coming from other counties. It's in France a sanitary reserve. But limits are quickly reached. And then the transport of ICU COVID-19 patients to other regions or other countries, just like we did with high-speed trains. Is it the end? Certainly not. Recently, we have used the same concept to transport more than 150 COVID-19 ICU patients by airliner from the Indian Ocean, the West Indies, and Polynesia to Paris.
Thank you, François. And now, Dimitri and Costa, back to the people. How are your staff, your colleagues doing after the year and a half in the pandemic?
These 20 months have been extremely difficult for healthcare workers across the globe. In Greece, we also had a restriction on taking vacation because of the shortage of staff. And it was only released in the middle of July, allowed some vacation time, and then it was cut off again in September because the government decided to, for healthcare workers who have not been vaccinated, to stop treating patients and be absent from work. So we had to cut off vacation time as well. So that puts a lot of strain on personnel. Also, a lot of strain on personnel is the personal protective equipment that they had to get in and out of the uniforms all the time. Fortunately, we didn't have a lot of cases, a lot of COVID cases due to work environment. We had a lot of cases from work, from home. And we try to put a message that you need to be safe at work, at home, as you're safe at work. Otherwise, you risk getting COVID. And that was, most of the cases were transmitted through home contacts. Speaking about that, I also forgot to elaborate on something that you asked me in the previous one. What about the islands? In Greece, we have a lot of islands, as you all know, but we also have an aeromedical evacuations service. In my real life, I'm an aeromedical evacuations doctor since 1994, so recently I started working there. What happened is we had to do a lot of aeromedical evacuations from the islands. Very early on, we understood the need to have isolation boxes, negative pressure boxes, to transport patients via air. The reason we wanted the negative pressure is because you don't know what the next patient is or how quickly you need to use the same airplane or the same helicopter for the next patient. So no time to disinfect the entire vessel. So we resorted to negative pressure chambers. We had the fortune of receiving from donations 7 EpiShuttle, which is very big, very heavy, but very, very efficient. And we were able to transport COVID patients using negative pressure isolation boxes. It became a bit hairy as the government opened Greece for this summer vacation. In August and September, we had to transport 70 people in September and 70 in August, which means these were the relatively heavy cases that needed air transport and not other means of transport. And during August, out of the 70, 22 aeromedical evacuations of COVID patients was in 1 week only from 2 islands, Mykonos and Pyrros. So that was a bit strained, but
these are the most beautiful islands.
well, but any case, we managed to do that. Mental stress is definitely something that we're going to see as we get out of it. People are resilient, but also people are tired, and that's for sure.
Thank you for raising this important aspect of care for our colleagues and their mental health. Costa, how is the situation in Austria?
You know, we are now in the how I call it, the regular pandemic mode. So
Yeah.
we have the normal business and we have the pandemic on top. As you said, in 2020, when we had these strict lockdowns, there were no traffic accidents, no people were falling down when cutting their trees, nobody was drunk on Friday, Saturday evenings. Now we have all this again and the pandemic. So we have 20% more events than we had 2019. That's what we are facing right now, but it's the new normal and we are doing it. The staff is now in the comm center. We are in a good mood because we, as our politicians say always, we are seeing the light on the end of the tunnel. But on the second thing, they are now getting angry. They are getting angry about people which are not vaccinated. We are in Austria. I'm also the state-wise coordinator of vaccinations in Lower Austria. We have now 74% of people older than 12 years with 2 shots, so fully vaccinated. In my center, most of the people, they have got their 3rd shot now. So we are vaccinated, and our people don't understand why are these people not vaccinated. We will have the end of the pandemic very soon, and they are seeing every day the cases getting up right now. Now we are a little bit on a down phase now, but they don't understand it, and it's hard for me to keep them in this good mood when they are calling with people not being vaccinated and now realizing that Corona is still not a fairy tale. And this is a little bit, yeah. But as I said, we call it the new normal.
The new normal.
The new normal, normal business and COVID on top.
I believe the societal aspects are of great importance when abstracting our lessons learned from the pandemic. Disinformation put a lot of people under pressure in finding which information are correct and what is the right path to take. And I believe that's going to be one of the challenges which we will need to be co-addressing in our response. Now we are slowly running out of time, and I would really like to give the audience a chance to ask questions. So I would like us to now focus on the pandemic takeaways. Are we adapting fast enough, and are we coping well enough, according to your perspectives?
We had the luck that we are always trying to be on top of technology. So my advice would be use every technology possible that may help you, and don't postpone updates, upgrades, or something like that. We did it with one telephone system upgrade, and it's now, 2 years later, and we still couldn't do it because pandemic came. So my advice is be always ready for what may come. That's one lesson we should have learned. And the second is your team has been motivated in peaceful times so that they can do even more when things like COVID is coming.
Thank you, Costa. Dimitri, your wise words for the world.
No wise words. The new normal is what we all have to get used. Technology really helped. It specifically in Greece, also it was an opportunity for the government to promote more digitalization of the government. So a lot of things happened that it might have taken a lot more time, but during the pandemic crisis, the need was there for people not to move, but interact with the government, fill out forms, stuff like that. So technology really picked up. And also in our call center, we even had a specific call center that we built from scratch to deal with COVID cases and where those COVID cases will go, either to a regular bed or to an ICU. And we took 3 people out of the computer department, and we dedicate them inside there, and they were working along with the doctors to promote more digitalization of what we were doing, and it was very successful. So yes, digitalization helps. Digitalization doesn't help in interacting with people like we do here, and we all see the difference of that, but it's still very, very helpful. And it was the time to promote this, promote digitalization. And I think it happened all over the world. That brought disinformation big time also, and that's something that we have to deal with. There is no such thing, no more dangerous thing as a health worker who is negative about vaccination, who's promoting that through social media. Because then the uninformed person says, you're a doctor, he's a doctor, why are you right and he's not? So that's something that we have to deal with, the disinformation and how big that disinformation went on social media.
Thank you very much, Dimitri, for raising these important issues. And now I'd like to ask for technical support in sharing the final 4th video from France that will actually help us understand what recommendations would they give to emergency medical services and authorities to prepare for future pandemics.
I don't have lessons for the emergency medical services, but just let me use the words of Sir Winston Churchill. Now, This is not the end. This is not the beginning of the end, but it's perhaps the end of the beginning. So stay vigilant and prepare to be surprised. Thank you very much, and I apologize one more time not to be with you in Letton. Bye and have a nice Congress.
Thank you, François. And now is the time for any questions that the audience would like to state to the speakers. I see no raised hands and no light voices, but is there somebody in the room who would like to perhaps spotlight an important issue that we haven't covered through a smart
Share
question?
a thought maybe about how you dealt in your country. Yes.
Talk to us.
Time.
Good morning. Thank you very much for very enlightening presentations. I would be the devil's advocate, and I would ask about the impact of false information on the personnel in your services, and for example, vaccination hesitancy, or people that are fighting against the restrictions and things like that. Thank you.
Thank you, Chaim.
Yes, at the beginning there was a lot of, people didn't know who to believe, and as a leader you have to be very clear about this and be a role model, I think. In my special case, I was designated by the government as the coordinator for testing and vaccination, and therefore we had additional information for all the employees. And I'm very proud that nearly 100% of my staff is vaccinated, but there are still also in my company people who don't want to be vaccinated because of their social environment at home, because of the special medical personnel which is giving false information. And in Austria, I'm as an advisor for the government, I want to have strict laws about it. So if you're a doctor and you are thinking that vaccination is not the solution, that maybe it's the devil thing and you get a chip implanted or something like that, and you're working in a medical environment, you must not longer work in this environment by law, because it's the same. There is no traditional Chinese physician or whatever. So to make it absolutely clear, if medical personnel is not acting on the newest medical edge of knowledge, they shouldn't be allowed to work, and they shouldn't be allowed to make a publication. The publication is very, it's not possible to make it because of Facebook and all the thing, but these people should not be allowed to treat patients. And that must be one of the results of this pandemic, I think. That's my idea.
Yeah.
Thank you for that reflection. Dimitri.
True. Let me give you figures. The nationwide ambulance service in Greece has about 5,000 people, almost 100 doctors only, 46 doctors in Athens. Athens has half the population of Greece anyway. I had in my service only 3 doctors who declined to vaccinate. Total people who initially, 1st of September, the government was a cutoff point. 1st of September, if you're not vaccinated, you get out of the service. No pay, you go home, you stay home for at least 3 months. We don't know what's going to happen next. 10 days before 1st of September, there were 560 personnel out of the 5,000, 560 personnel out of 5,000 who were not vaccinated. The government put its feet down. It said, no ifs, no buts, 1st September, you're out. We came down to 320 from 560, in 10 days, 560, 320, 320 stayed, the 3 doctors are out. Again, good colleagues, but I have no regrets. If you don't understand the science, or if you, for some reason, this particular vaccine looks suspicious to you, well, that's your problem. It's not suitable for you to work in the National Health Service in Greece, and that should be a loud and clear message, period.
Thank you for these important messages. I'm afraid we're out of time, so in conclusion, I would like to also spotlight the analytical work on the lessons learned by the EENA team, which resulted in principal recommendations for the inclusion of the establishment of a non-emergency number before crises to provide the reliable source of information to the public, and release pressure on emergency services and call takers. The second principal recommendation arising from this important work is the strengthening of interagency cooperation to empower services in supporting each other, ideally in interconnected PSUBs, almost multidisciplinary call centers, but as close to each other as possible at the operational level to be able to support each other. Now, acknowledging the size and scope of the pandemic challenges at all levels, starting with personal, is key. As we need to reflect, take time to heal and recover, be present for each other as we address doubts and anxieties, frustrations of lost opportunities in strengthening preparedness and preventable failures, to eventually make space for celebrating the achievements, the bravery, the dedication of our call takers, and first responders, and focus on the new knowledge we collectively gain to prepare for the next challenges which will be arriving. It is going to come, and we shall be there again, wiser, stronger, at each other's side, across borders, institutions, and agendas, because that's who we are and how we work, making the world a safer, more resilient place for all together. So. Thank you for taking the time to speak to us, and let's do this together from now on.
Thank you. Thank you, Ruth. Thank you, Costa.
Thank you.
Thank you.